again, because this is a more recent case we were working with, and kind of a more, and so kind of recent version of this discussion around imaging results, patient psychology, and just making sure that when you're talking to people that you're always framing everything in a way that's going to improve outcomes and give the patient some sense of that, some sense of hope and things like that for the future. Because this recent one we had, a person in a accident, and they took her to the hospital after the accident, ran CT scans. It's pretty typical if the patient opts to go to the hospital from the scene, they're going to go through the emergency department, and they're going to end up having CT scans, usually of the head, neck, and anywhere else that the patient is complaining of. And this is a person who they reported a prior history of stenosis in the cervical spine, and prior history of like chronic neck pain, things like that. And when I had my initial this is before we got the imaging, I had my initial discussions with the patient after they came into our office. They were describing to me, they'd had neck pain in the past, chronic, and it was due to all this severe arthritis they were told they had, and spinal stenosis they were told they had, and they'd had from some previous imaging, and whoever reported to them reported the findings of the imaging in a light that made the patient very worried, concerned about their future self. And so I just wanted to read through, the findings, the impressions of the CT scan that we got back from the hospital. She had not seen the reports yet from them, and so they were sent to us. And the main impressions: no cervical spine fracture, so that's good. And then the last thing mentioned is minimal multi-level degenerative changes. Given the person's age, that's someone in their mid to late 30s, that's to be expected regardless of person's presenting symptoms. Then the other part of it is no spinal canal or neuroforaminal stenosis. So a couple of things here. Either the patient, the previous iterations of their care, had been told things that aren't true about what's seen on their imaging, or reports were sensationalized on hello, or the report was sensationalized to the patient in a way that would get the patient to continue some sort of care plan, and then or the patient is hearing things incorrectly. And it's always challenging to know, because I wasn't treating whoever, this person back then, and so I also don't know where they were and who and what kind of imaging was taken. But this is a person who at one point or another in the past had been told some things about some cervical spine imaging that led them down a path of medications, care that was probably not necessary, worrying about the problems that were reported to them in their spine, causing them to catastrophize their neck symptoms and things like that. And so when I read this to the patient and said, hey, there's no stenosis, and we're not seeing any changes that we wouldn't expect to see in someone your age. And it was almost like, when you say it to a person and it's so different from what they had been told previously about what was seen on imaging. And again, this or the third possibility is the car accident fixed them. Who knows? But But when you turn around and tell someone something very different from the story and the narrative that they were told the previous time that they had imaging done, it could create a lot of confusion uh, in the patient, and like a cognitive dissonance almost. They're like, wait a sec, I've been worried about what I was told was severe problems with my neck for X number of years, and I happen to have this CT scan read by professional radiologists at a fancy hospital after this accident. And you're telling me that all that stuff that I was told was wrong with me before isn't necessarily true. And it's always a challenging position to be in as the clinician, because here I am just reporting truthfully what I've been told from the radiologist. And I don't know much about the previous one, but the important takeaway from this is imaging reports are a powerful tool when you're someone who is looking to use imaging as a way to sell a person in front of you on some sort of treatment plan, or something that you think that they need to get better. So the assumption on the end of the provider would be that the person that you're talking to doesn't really know much about what a report says, and so you can take the words that are written by the radiologist and spin them, sensationalize them in a lot of different ways to cause undue concern in the person in front of you. So just make sure as clinicians that when you get imaging reports that you're very truthful in your reading, and that you keep things in context of the person, and that you help them understand that what we're seeing on the imaging doesn't necessarily mean permanent problems or pain. And most of the time, unless we see fractures or dislocations, the stuff that was on there, even if you had no symptoms before, was there anyway. So we're going to be okay. And just always try to leave people with hope, and pointing them with an aim that they're going to improve and can be fine, regardless of what this says. So hope that helps, and catch you guys next time. Go to my YouTube channel, check out everything else.